In fact, we're talking about vaccinations. Let me take you to the province of Mpumalanga, where officials continue to encourage citizens to get inoculated against the coronavirus. It is estimated that the province has given vaccines to over 350,000 of its 4 million population. eNCA's Khayelihle Khumalo is in the mining town of eMalahleni, tracking health officials and the Premier's inspection of vaccination sites there. Khaya, I believe you are joined by the Premier of Mpumalanga, Refilwe Tsepane. What has she been able to see during her time of inspecting how the vaccination sites are working in eMalahleni?
Well, that's right, Tulasiza. So it's been a very comprehensive day, as it were, in terms of the inspection. Obviously, it forms part and parcel of the provincial government, encouraging the private sector, but also collaborating with them. So today's focus is around the mining sector. We do note that Mpumalanga has quite a vast amount of mines. So we're here at Exaro Matla mine. But the Premier joins us now, and one of the key messages she was highlighting was around the issue of vaccine hesitancy. Thank you so much indeed for your time, Madam Premier. In terms of your province, how are you doing in terms of ramping up the campaign around vaccination?
No, thank you very much for having us. As the Mpumalanga province, we are working very hard to make sure that we mobilize as many of our people to go and vaccinate. And thus far, I must indicate we have seen progress, but it's a bit slow. It's not in a rate in which one would have expected. But that be as it may, we make it our business to make sure that we mobilize our people through our civic societies and also our municipal councils, and of course through our CDWs to go out and encourage most of our communities to go out and vaccinate. So what we are here, as you can see right behind us, the mine, the Exaro group has actually established their own laboratory where they are doing their own testing through the occupational health and safety strategy, which is a good initiative, which we think that if it could be inculcated to other mines as well, it will to some extent by and large assist us in testing, and then so that immediate actions are taken to remedy the situation and manage COVID amongst the employees. Because you are correct, most of the people who reside here in Mpumalanga, and in particular here in eMalahleni, are mine workers, and therefore it is very crucial that from this point, COVID-19, it is properly managed so that we try and cap the spread throughout to their families as well. What is nice is that these facilities are not only going to be used just for the employees only, but they are going to also be extended to the community members who reside within the proximity where they are mining, which is a good initiative in partnering with government. So we welcome that initiative as government, and we once again want to take this opportunity for all our mine companies, the CEOs. They've agreed to open facilities, their facilities and their own resources, be it in a form of the infrastructure and also human capital, so that we partner and collaborate together to make sure that we test as many people as we can see. As you could see today, we are also being accompanied by one official from DMRE, which then shows that all government institutions are here. We've got our municipality as well. So we are working in collaboration with each other to make sure that we play our role in making sure that we get our people to be tested and take vaccination. And once again, we want to say to our communities, even if you have taken your vaccination, you still have to adhere to COVID-19 protocol. It does not mean that you must take off your mask. It does not mean that you must not adhere to social distance. And we want to discourage them to avoid crowded areas, in particular where they are in-housed and there's no enough ventilation that circulates within the room. Because of those areas, in the main, what we have seen, those are super spreaders, and that it creates a lot of problem. And as a result of that, then we see this rampant. For the first time in Mpumalanga, ever since we started with the management of COVID, we've registered quite high numbers in this third wave. We were doing very well in level 1, level 2, but we have since seen the quite drastic improve with this COVID level 3, and therefore we had to get up and change our system as to how do we cap the spread of this virus. Our operation system has always been that we work wall-to-wall approach, according to a wall-to-wall approach. As you can see, when we are analyzing and reporting on COVID statistics, we are reporting them in accordance with the wards. Seated here in eMalahleni today, we know how many wards that are adversely affected by this COVID-19. Out of the 34 wards, we have identified 8 wards where the COVID-19 is prevalent at this point in time, and it varies in accordance with the percentages, and those are the wards that we will zoom in terms of making sure that we assist those communities in terms of awareness and making sure that they go out to do the testing, and if they've tested positive, there's proper management. And we want to urge once again our communities to do the right thing by going out and get the vaccination. That will reduce their chances of them being admitted in hospitals and to some extent having to lose their life as a result of COVID-19. We've been tested. We've never had any adverse effect thus far. As you can see us, we're going on with our normal life and adhering to COVID-19 protocol. And therefore, the myth that is going around, it must be demystified, and we urge our people not to be skeptical about this vaccination. At this point in time, this is the weapon that we have at our disposal as government that we are utilizing to combat the spread of the virus.
And just once again, Madam Premier, a strong weapon you have in your disposal. We saw the schools reopening, but there was an issue around the vaccine hesitancy among some members within the education sector. But your province, how is it doing on that score in terms of encouraging teachers and non-teaching staff as well?
Well, what we have seen, fortunately, in our province, in terms of teachers' vaccination, I can safely confirm that about 88% of them, they've already vaccinated. We have a relatively few of them who has not as yet vaccinated due to them being reluctant to do that. So from our side, we are quite comfortable, but we'll still continue to persuade those who have not vaccinated to make sure that they are comfortable and do the right thing by vaccinating. The difficult part of it, unfortunately, we can't enforce it to anyone. It is voluntarily, and therefore it's just a question of a mindset shift to say that which we think it is not. And therefore it goes with the responsibility of a wellness program, so that psychologically, if people are hesitant as a result of feeling that they've got the vaccination phobia, we assist them so that at the end of the day they are quite content and comfortable with the vaccination process.
All right, Madam Premier, thank you so much indeed for your time. Really just elaborating about the measures the province is putting to deal with this particular pandemic, and really emphasizing as well to quite a number of companies to come on board to have more collaborative efforts with the state. We know that tomorrow they'll be targeting the farm workers, but also going to other rural areas as well here around Mpumalanga.
Thank you for that. That's eNCA's Khayelihle Khumalo out in eMalahleni in Mpumalanga.